important because physician associates are going to be banned from treating patients on their own, apparently, under new guidelines. This was a role that was kind of created, I suppose, by the Royal College of Physicians to help out in GP surgeries in particular, and to try and sort of create another space for the backlog to go. Let's find out from Bhasha whether that is indeed something that is welcome. Bhasha, very good morning to you.
Good morning.
Thanks for talking to us. I mean, I don't think I've ever come across a physician associate, so I'm not really sure how widespread they are. Do you know much about them, and do you reckon this is a good idea?
This is the problem. I think part of the problem why you probably haven't come across them is because a lot of them don't always introduce themselves as physician's associate.
Right.
There is a culture of introducing yourself as a clinician or some parallel name, which means that the patient doesn't know who they're seeing.
Right.
And so that can be quite dangerous for the patient, because then they can take on the advice given by the physician's associate, and sometimes a lack of advice given by the physician's associate, and go home and do unsafe things. And that's happened to me personally as a patient myself, where a physician's associate who introduced themselves as a clinician prescribed me a cream, which then broke me out, actually gave me chemical burns on my face because he didn't actually tell me how to use it. And because I told her I'm a GP myself, or a doctor myself, she gave me what I wanted, didn't ask any questions, didn't run me through exactly what I needed to do.
Right.
That is an example of an unsafe practice. It's a good thing I'm a medical from a medical background, so I could do my own research and do the corrective measures. But I feel really for our patients who might be going in there thinking they're going to be getting the advice, the quality of care of a doctor who's gone through years and years and 10 years, 15 years of being in the medical profession. And then they're getting, obviously, a physician's associate telling them advice, which may not be medically accurate sometimes. So I think supervision is really important. Definitely in the practices that I've worked at, we've had in the GP practices, all physicians associates so far, to my experience, have been supervised. But in hospital, I think it's quite difficult because obviously it's more busy, it's more chaotic. There are not enough consultants, not enough supervising doctors who can essentially supervise these physicians associates. So that does mean they are working more self-directedly, and that can be unsafe.
Yes. So how would you know if you're a patient and you go into a doctor's surgery whether you're seeing one of these people? Are you allowed to ask if they are indeed qualified doctors, or do they get upset if you do that?
Well, I would absolutely think that it's every citizen's right to ask who they're being treated by and the qualifications of who they're being treated by. I've been asked myself, how old are you?
Right.
Because sometimes patients might feel that they're not being seen by someone experienced enough. I've actually been called a rookie whilst I was a junior doctor as well. And then sometimes, even as a female, I have to do this every day almost, where I have to say, no, I am the doctor. So I face a different type of discrimination myself as a female doctor, where often I will get compared with male doctors and I might not be taken seriously enough. So I have to do the introduction all the time, and I always have to introduce myself. So I think as a patient, it is your right to definitely ask, what are the qualifications? What are the, experience level of the person that's treating you?
Right. Okay. Well, let's hope that they would answer honestly. And if you see one of these people, say for example, and you don't fancy the idea of seeing a physician associate, and you go, "Excuse me, would you mind if I actually see the doctor instead?" What would happen then?
I think that is quite difficult sometimes, because genuinely we do have understaffing in most trusts, in most hospitals, in most doctors. And generally speaking, there should have been a vetting process where for the problem that you've gone in with, that might be appropriate for a physician's associate to see. However, we are entitled as citizens to actually ask for a second opinion. So absolutely, you can say that actually, I think this is a problem that I want to see a doctor for. It might mean that you have to book another appointment. It might cause some contention. But I think if you feel uncomfortable with the advice given to you. If you feel the person that's dealing with you is not probably getting to the crux of what you've come in with, you can absolutely ask to see a doctor.
Let's talk about some of the other problems in the NHS. We've got a story today in the Mirror talking about a new guide on treating patients in corridors. And some people are saying that's not a good thing to do because it sort of normalises dangerous practices of, not allowing people into beds properly. But, most hospitals, certainly that I've been in, they're overcrowded. They've got people in corridors. They're on, sort of, gurneys waiting to be taken into a bed if they can be found one. So it seems quite sensible for doctors to be told this is how you treat them in the corridor, doesn't it?
Do you know what? The word that you use, normalising, well, this has been the norm for years now.
Yeah.
I mean, it's becoming more and more normal every day, pretty much. I'm glad that there's some guidance on this because it's frustrating. When I was working in A&E, it was frustrating to see 90-year-old patients waiting for 7-8 hours on these wooden, uncomfortable chairs. And let me tell you, the beds in A&E or even the little rooms or the little allocated seats that are given to patients sometimes are not that much better. Sometimes they're not tended to any faster just because they've got a bed or a side room.
No.
In fact, the staffing levels are so low sometimes that I feel for some of these bed-bound patients who might not even be able to ask for help, call for help while they're stuck in the side room. Whereas at least in a corridor, you've got people passing by. Yes, I absolutely agree that it's not dignified at all. But the most frustrating thing was when I was working in A&E, and I would be trying to treat patients, see patients in the corridor, whereas we'd have a hoity-toity senior nurse who was an infection control nurse coming and say, you can't see the patient here. What am I supposed to do?
Right.
There is nowhere to see this patient. I've got to try and get through the list, get this patient home. I don't want them sitting in the waiting room, 90 years old, until they're literally passing out because they've dehydrated, not eaten anything, becoming more unwell. So I'm glad that there's some rules coming in at least as to how to do this safely, how to do this in a dignified way for patients, because this is the new reality of the NHS.
Yeah, absolutely. It absolutely is. Bhasha, good to talk to you. Thank you very much indeed. Bhasha Mukherjee, the NHS doctor, on the subject of physician associates, apart from anything else, and getting treated in corridors. We always like to hear your stories about the NHS. I know you always have them, and they're always terrific. So if you've had any kind of encounters with these physician associates, I haven't, so I can't tell you whether they're really good or not. But basically, they're not allowed to see anybody on their own now.